So hello to everyone and welcome to this week's vlog. I hope that you're all doing well. It's quite amazing to know that now in July, it means that we've roughly reached, believe it or not, the 6-month mark in our COVID-19 response. And I expect we'll still be dealing with the pandemic for the rest of this year and well into 2021. As an organization, we've already made countless decisions related to COVID-19 and with countless more still to come. And because we're a learning healthcare organization, our decisions are always going to be based on the best data available and the best evidence. And that's why AHS is so fortunate to have such outstanding analytics and public health surveillance teams that from the very first days of 2020 have provided us with the best possible information, which we have used to help shape and guide our COVID-19 response. So today I'd like to highlight their work. So with me is Dr. Stafford Dean, our Chief Data and Analytics Officer, Dr. Hussain Usman, Executive Director of Public Health Surveillance and Infrastructure, Dr. Jason Cabaj, a Medical Officer of Health in Calgary Zone, who supports the Public Health Surveillance team, and another Jason, Dr. Jason Scarlett, who is a Health System Engineer and Strategic Analytics. So good day to you all, and thank you so much for joining me. So I'm going to start off with Stafford. Staff, can you maybe explain the difference between analytics and the public health surveillance teams?
Essentially a hub and spoke model where data and analytics, the hub that I manage, supports the analytics teams that live out there. And so really we all synchronized and work together, but we're all within our own domains, and the pop health teams are the experts in the population health surveillance, communicable disease area, and they did quite a bit of the work and started a lot of this work going on. So that's kind of how the overall structure is.
When did you and your team really start responding to COVID-19, and what exactly did that entail?
So I remember I received a bunch of calls on a Saturday, I think it was March 15th, from ED docs and other docs, all doing their own modeling because they were very worried. They're pulling data from all over the place and had quite a bit of scenarios that were making people anxious. And thankfully enough, I think Pop Health Data Analytics team was way ahead of us and already doing the modeling for where the peak demand may be and how long that would take to hit there. And so we got pulled in a little later, and they were really doing the initial population health, epicurve demand. So we jumped in and supplemented a lot of that with early warning systems and additional reporting products that we'll get into a little bit later.
So when the COVID pandemic started and Stafford was sharing with you, we already had a head start in a sense that we are working with a very good infrastructure in AHS. Having access to data is very important. Having skilled staff with all the tools available to them. So we started putting together our initial surveillance products. So we started with traditionally time, place, and person, started putting together Alberta COVID-19 surveillance dashboard to inform the leadership and other groups on the number of cases that we are seeing, where we are seeing them, what are the basic characteristics of those cases, and then also the severe outcomes, for example, the hospitalizations, the ICU admissions, and unfortunately, in some cases, the deaths. So we also had information about the emergency department visits, health link calls, and a few other areas that we started working in. So, and the last one in this section I would mention is a product that focused on the outbreaks.
Jason, can you explain exactly what public surveillance involves and how are we able to track the spread of COVID in the province?
We really had 4 main objectives in our surveillance, and in wanting to be able to track the transmission and the spread of the disease, look at the impacts on the healthcare system, both the direct ones in terms of the burden it's causing, indirect impacts on health system and society, and then how effective are the interventions that we're using both within the health system and then more broadly, of course. It really requires a team effort to do all of those components and carry out all of those components of surveillance, from the people that are collecting and entering the data into our systems, all of the investigators, and that of course has been a major challenge with how significantly we have had to ramp up some of the teams and the volume of the work, especially during that peak of the initial wave. And then, as mentioned, our analytics teams and epidemiologists, both within Alberta Health Services and then our partners in the ministry and in other organizations and local government as well, in using that information and sharing it in ways that are really helpful to inform decision making.
So Jason, Scarlett, just moving on to you, I mean, it really is quite amazing how you did some preliminary modeling projections even before, you know, the first case was confirmed in Alberta. So maybe if you can enlighten us about what data were you pulling from and what assumptions did you use to base the models on?
Originally, the data that we used came from China. It was the first place that the outbreak occurred, and so we started with the data from China. That was the early assumptions, the same hospitalization rates, the same infection rates, but over time that started to change, and the numbers from China changed, as well as from a number of different areas. And so we adjusted the models to reflect the new data that was rolling in. As it continued to roll in and became closer to Alberta, we continued to modify the models and use the data that was using our local context. So that's how it started, and it's evolved. And even to today, every week, we continue to adjust the models and adjust the data that we're using in them.
So Stafford, can you describe some of the information your team and public health surveillance are making available online, and perhaps talk a bit about the early warning system and what it's used for?
I think right now we have a count of 120 different products, and they span all sorts of domains, from the early warning system we talked about to the long run POP projections to staff and PPE and real-time, near real-time surveillance in the hospitals and all of that. So really, really robust set of reporting that was developed, automated, and maintained. And again, I think that's a real statement to the advantage of Alberta Health Services. We were ready to go and pounce and had our infrastructure and data there and all work together. On the early warning system, but that was to complement the POP health projections on the epi curves and the peak COVID cases and stuff. And that was actually directly measuring our hospitalizations in the system as we observed them.
So moving on to Jason, Scarlett, how often do you and your teams update the data, and what does that involve?
There is a lot of data flowing behind the scenes. Some of it is flowing hourly, some of it is flowing daily, some of it is weekly, and there's a team of people that are pulling these different data sources together. They're really doing a great job. Some of them have to scrub it from email, others are taking them from our clinical systems, but all of these data sets come together in a raw format, and we have to do some cleaning. There's some quality control that has to happen first of all. Once that's cleaned and we've put it into a nice analytically friendly table, we can start to mine the data. We can start to look for correlations and patterns. And from there, what we really want to do is take those insights that as analysts we discover and surface them. We want to bubble them up and present them interactively, visually to our end users so they can actually understand what the data is saying.
I actually love the modeling projections. I actually look at it every single day. And I know that when we look at those, they're just guides, not predictions, but it is really reassuring to know that our actual hospitalization and ICU numbers are lower than our modeling scenario showed. So maybe describe some variables that enabled Alberta to keep these numbers so low.
I think really it comes down to the infection rate and the spread. What has allowed us to keep it low? Is it the reduction in the size of the clusters? Is it the frequency of the clusters? Is it the population density? Is it the social distancing measures? I think it's a combination of these things. There are a number of things that Albertans have done that I think have kept the curve relatively low and relatively flat. And so I think that's a good shot in the arm for Albertans, that we've done a great job keeping control and keeping this under wraps so far.
So Hussain, moving over to you, can you explain to us what this data has helped us do over the past 3 months and what the data can help us do as we move forward during the relaunch?
There are decisions, or in the past, there were decisions made in terms of public health interventions. Jason has mentioned the social distancing measures or other types of interventions that have been put in place. We believe that the surveillance data that we have been producing in last few months has helped our leadership in Alberta to make those decisions. And those decisions, as we can see, have been effective, particularly the social distancing. And I think not only the decisions are important, but the timing of those decisions are extremely important. When you make a particular decision, it matters in the long run, and it matters in terms of the desired outcome that you're trying to see there. So that's on the side of the public health interventions. But on the side of AHS, we also believe that the information or the evidence that we were producing from the modeling or other types of surveillance work that we were doing has helped us on the AHS side making decisions to prevent overwhelming the system in terms of like selecting how do we create what type of burden we are expecting, and how do we create the capacity so that we can handle those patients who will be admitted in the hospital and all that. So I think all that has worked really well. And then moving forward, when we talk about the relaunch, it's all about, as I said, surveillance never sleeps. So keeping an eye on where the situation is, and so that our leadership can calibrate their decisions, they can calibrate the interventions that are in place, so that we can keep the curve flattened as much as we can, and then hopefully we can prepare for the wave 2 in a more effective manner.
Surveillance is really a foundational public health function that informs really all of the work we do in public health. I mean, as Hussain mentioned, in being evidence informed, there are other sources of information like research and evaluation, health status info, community preferences and context, and all of those factors. But surveillance and the analytics world really informs all of the activities we do to prevent and control disease.
So final question for Stafford and Hussain. We're now on the back half of 2020. So what's your prediction for the next 6 months? How is it going to look for your respective teams? Stafford, I'm going to start with you.
What we really need to do, I think, is move forward, and this is the work that we're working on now and we'll be working on in the future, is have a more refined approach to responding to future waves. We don't want to be able to reduce capacity to the extent that we did. There are anticipated consequences potentially with that. And if we have smarter responses to deal with the waves, we can still really keep our hunting at a pretty good level of capacity and manage the COVID in the future. That's the hope.
Now that we know how our response looks like, moving forward, the speed of our response and the quality of our response is going to be extremely important. And we are strategizing how can we create the tools for our medical officers, for our leadership, so that it can help them in making their decisions and address the speed aspect of it. And when it comes to the quality of our all COVID activities, there's a big project being led by Dr. David Strong, where we are developing for all activities under the COVID response, starting from the communication we do with Albertans, enforcement activities, case finding, case investigations, contact tracing, protecting our vulnerable populations. So we are developing output, outcome, and quality indicators for each of these activities that I have mentioned.
Thank you for this fabulous conversation. We know that preparedness has definitely been key to the success of our response. There are a few silver linings of COVID that you've all described, such as seeing the incredible collaboration across the province amongst all the portfolios, the incredible teamwork, the recognition that it takes all of us to be part of the solution, no matter where you are in the organization. And for me today, learning about some of the areas where there's not always the recognition that is so well deserved. So thank you to all of you for joining me today. And also thanks to your teams for the crucial work that you've been doing. As Hussain said so well, and because we've all been working so hard, I hope that you can find some time over the next couple of months to take some time off, enjoy the summer, recharge, spend time with family and friends, while of course adhering to public health guidelines. AHS needs each and every one of you as we continue to respond to the pandemic, and it's so crucial that we take care of ourselves and each other. So thank you for watching. Thank you for everything you do, and I will see you next week.
Together, we do amazing things every day.